Hello friends, I am Dr. Sweety Mety. I am a practicing neurologist in the Bhaktivedanta Hospital and in Cardinal Gracious in Mumbai. Today we are here to talk something about epilepsy to celebrate the Epilepsy Awareness Month of March. Epilepsy is what we call as mirgi, akdi, kheech, convulsions, fit ya jhatka in common language. Now let us see how our brain functions like. Brain is a complex network of electrical circuits. Any abnormal electrical activity in the brain cells leads to an abnormal behavior episodically in a human being. This is what we call as epilepsy. In short, it is like a short circuit in the brain. Epilepsy is a chronic neurologic disorder where you get recurrent fits, whereas a seizure is a single episode of fit or convulsion. Now let us see how is this epilepsy caused or what are the causes of epilepsy. Epilepsy is not a curse of God. There are various reasons for epilepsy. The common and treatable causes are like low blood sugar level, especially in a patient with diabetes. A person with diabetes who say misses his meals or has any illness but is regularly taking his medicines can get a fit or a convulsion. Other causes like excess of alcohol intake or alcohol withdrawal can also cause epilepsy. Apart from these, infections are an important cause of epilepsy in India. Tuberculosis is another common infection in India which can give rise to epilepsy. Other important ones are like neurocysticercosis, which is caused because of intake of eggs of tapeworm in our food. It is very important, therefore, to wash fruits and vegetables properly before eating and to eat well-cooked meat. Medicines and toxins can also be a cause of epilepsy. Certain antibiotics or painkillers can provoke a fit, and therefore a patient with epilepsy should tell his doctor what all medicines he is taking, so that the doctor comes to know which medicines to avoid in a patient with epilepsy. Toxins which are excreted by the kidney or liver disease can cause epilepsy. So a patient who has a chronic kidney disease or liver disease can have a problem of epilepsy. Apart from these, any injury to the brain, any birth injuries during birth of the baby, any brain tumor or a mass in the brain can also lead to epilepsy. Stroke is a cause of late onset epilepsy. In stroke, what happens is a part of the brain becomes dead, and these dead cells can sometimes give electrical discharges which can lead to epilepsy. After seeing the causes, let us see how will you identify a patient who is convulsing in front of you. Patients with epilepsy sometimes get a warning before the fit. That can be in the form of an aura. Say for example, the patient may have some ill feeling or unwell feeling, sometimes some headache or butterflies flying in the stomach, flashes of light in front of his eyes or some peculiar odor or smell. After this is what we see a convulsion. A patient who is standing may have suddenly uprolling of his eyes. There can be clenching of teeth, frothing from the mouth. If he is standing, he may fall, his limbs become stiff, and then what we see is the jerking or the shaking of the limbs. This lasts for a few seconds to minutes. After this, the patient becomes unconscious. During the jerking phase, he may have a tongue bite or he may pass urine in his clothes. The patient remains unconscious for a few seconds or a few minutes. After he becomes conscious, he gets headache. He may get a bout of vomiting. He may have body ache or headache. There can be injuries to him during the convulsions, or he can have fractures or dislocation. After this, the patient feels tired and he may go to sleep. This is the common fit which we all might have seen sometime or the other. But there are other types of convulsions also. There are focal convulsions where the patient may have shaking or jerking of a part of a body like the hand or maybe a leg or the face, which twitches for a few seconds or few minutes. During this phase, the patient does not become unconscious. He is aware of the movements. There are other types like say absence seizures in which the patient is just lost from the environment. He doesn't remember what happens for a few seconds or a few minutes. He is staring. He may have some lip smacking movements, some blinking of eyes lasting for a few seconds. This generally starts in children, and teachers complain of unattentiveness or inattentiveness of the child, but actually he is getting convulsion. There's something called as myoclonic jerks, where the patient gets a jerk in the hand or in the leg. If he's standing, he may fall. If he's holding something, he may drop an object from his hand. And then in a second, he is normal. These are known as myoclonic jerks, which are common in young females. These are the common types of convulsions. Now, after recognizing what a convulsion is, let us see how to diagnose a fit or epilepsy. The diagnosis of epilepsy is basically clinical or from the history. As most of the times, the patient with epilepsy will not remember what exactly happened to him. It is the patient's relatives, his parents or the onlookers who exactly might have seen what had happened to the patient during the attack. And this history is very important for the diagnosis of epilepsy from the doctor's point of view. If possible, a video should be taken so that the doctor will be very easy to diagnose the epilepsy. After this, there are some investigations which are necessary to be done in a patient of epilepsy. The most important is EEG or the electroencephalogram. The EEG is just like the ECG of the heart. As the ECG is the electrical activity of the heart, the EEG represents the electrical activity of the brain. This electrical activity is recorded, and if the EEG is abnormal, the diagnosis of epilepsy is confirmed. But a normal EEG does not rule out epilepsy. So even if the EEG is normal, it doesn't mean that the patient does not have epilepsy. The other important investigation is the MRI of the brain. MRI of the brain helps us to find out the cause of the epilepsy. The MRI may be able to show you the brain tumors or any mass in the brain, any head injury or any scar, any stroke or any birth injury, which may be one of the causes of the epilepsy. Apart from this, there are other investigations which may be necessary for the patient to diagnose epilepsy. Once we have diagnosed epilepsy, let us go on to the treatment. Epilepsy is a treatable condition. Earlier there were medicines which were very few and they had a lot of side effects, so epilepsy was kind of a stigma in the society. But now we have many more effective medicines which have very less side effects and can control epilepsy in a very good way. What is important from the patient's point of view is to take these medicines regularly. Not even a single medicine or a tablet should be missed. A single tablet missed can also give him a fit. These medicines need to be continued for around 2 to 3 years regularly. If the patient does not get a convulsion or a fit for 3 years on regular medicines, then a EEG is repeated by the doctor. If the EEG is normal, then we go ahead with reducing these medicines and stopping them gradually. But all this has to be done under the careful guidance of a neurologist. Certain precautions which are necessary in a patient with epilepsy is they need to avoid driving, swimming, working with heavy machines, working near the flame, especially until the epilepsy stabilizes. Now let us see into some issues special issues like females with epilepsy. Women with epilepsy is always a special issue because the treatment of women with epilepsy is challenging. Females go through many phases in their lives, right from puberty, then to marriage, conception, pregnancy, childbirth, breastfeeding, and lately menopause. Female sex hormones affect the epilepsy or seizures. Basically, there are two sex hormones in females. One is estrogen and the other is progesterone. Estrogen is the bad hormone. It worsens epilepsy, whereas progesterone is a good hormone and it can prevent epilepsy. There are certain types of epilepsies which clusters around the menses period, and these need to be tackled with special medicines. So it is necessary to keep a good record of the epilepsy or the number of fits, the time during which it occurs in a month, so that the doctor will come to know that it is something called as catamenial epilepsy. Marriage in women with epilepsy is not a contraindication. A woman with epilepsy can marry and lead a normal life. Only thing is, she has to disclose this to the life partner before marriage. Contraception is another important issue in women with epilepsy. Contraceptive medicines interact with the medicines of epilepsy, and therefore the doctor should be given the treatment or any other medicines the patient is taken, so that the dose and the drugs can be adjusted according to the contraception the female is taking. The female should inform the doctor whenever she decides to conceive, so that the treating doctor can start with folic acid supplementation and make any changes which are necessary in the medicines she is taking for epilepsy. Pregnancy most of the time goes normal in women with epilepsy. If the woman has not got a convulsion in last 1 year on medicines, has very less chances that she will get a fit or a convulsion during her pregnancy period. The medicines which she takes has to be very regular during the pregnancy period, because a single convulsion can affect the mother as well as the baby. Delivery or childbirth most of the time goes uneventful in patients with epilepsy, only if she takes her medicines regularly. So it is very necessary not to miss on the medicines. Breastfeeding again is not a contraindication in women with epilepsy, as the benefits of breastfeeding are far more than the harms with the medicines. So a woman with epilepsy can breastfeed her child safely. So in summary, woman with epilepsy is not a stigma. She can get married, she can live a normal reproductive life, and she can have normal children. Now let us look at what should one do when he sees a patient who is convulsing in front of him. So do's and don'ts during epilepsy. The onlookers should not get panic, they should stay calm. Let the epilepsy go through its own course. Do not try to restrict the movements of the convulsing patient. Do not give him shoes or key in his hand. Do not give him shoes to smell. Key or any metal object in the hand can injure the patient. If the patient is tending to fall, prevent him from falling. If he's at a height, see to it that he doesn't injure himself. If there are any sharp objects around him, remove those sharp objects so that he doesn't injure himself. Do not try to put anything in his mouth like a spoon or any metal so that he doesn't injure himself. At the most, you can give him some soft cloth like a handkerchief or a napkin in his mouth to prevent a tongue bite. Do not try to give him water to drink or medicines during the convulsion, as it can lead to choking. If the patient is wearing any tight clothing like a tie or a dupatta, try to loosen it so that it prevents choking. let the seizure stop, and once the seizure stops, turn the patient on one side, clear his mouth so that he doesn't bite his tongue and he doesn't choke. In summary, patients with epilepsy can lead a normal full life. It is not a curse of God. The only thing is they have to take regular medicines. People who have got great names in the world like John T. Rhodes and Charles Dickens have led a full normal life on regular treatment. Thank you.